Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., PhD, in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about the role of social workers in nursing homes. And I'm joined today by Nancy Kusmaul and Lynn Feinberg. So welcome, ladies.
Thank you. Thanks for having us.
So maybe we'll start with some introductions. So Nancy, tell us a little bit about you and the work that you do.
All right. So I'm on the podcast because I'm a Health and Aging Policy Fellow this year, but I got there through a long social work career in nursing homes. I was a nursing home social worker for a decade, went back to school, got a PhD, and I've been teaching social work at the University of Maryland, Baltimore County for the last 7 years, and became interested in policy, realized early on how important policy was for day-to-day life in nursing homes, and so decided to explore the Health and Aging Policy Fellows Program as a way to learn more about how I could make a difference there.
Okay. And Lynn?
Well, I have a master's degree in social welfare and gerontology from the University of California at Berkeley. And I am currently a senior strategic policy advisor at the AARP Public Policy Institute, and I work on primarily family issues and long-term care. But for most of my career, actually for over 2 decades, I worked in San Francisco at the nonprofit Family Caregiver Alliance. That was the first community-based organization in the country that really recognized the role of families who were caring for loved ones with adult onset cognitive impairments like Alzheimer's or Parkinson's or MS. I was the director of research and information programs for many years, helping to provide training and technical assistance to a statewide network of caregiver resource centers across California that were modeled after Family Caregiver Alliance. And then we set up a national center on caregiving, and I had the good fortune of being the deputy director of that center. And then in 2007 and 2008, a while ago now, I had the honor of being selected as the John Hines Senate Fellow in Aging, which was the precursor to the Health and Aging Policy Fellows program that Nancy's part of, where I worked for former U.S. Senator Barbara Boxer from California on aging issues.
Okay, well, I appreciate both of you being here with me today. So Nancy, tell us a little bit about right now nursing homes and COVID are very kind of hot topics. So tell us a little bit about your health and aging policy placement and some of the work that you did.
So I started the placement before COVID, and so I was looking to learn more about nursing home policy, but also get an experience that was unique and different from what I did every day in academia. So I actually had 2 placements. I was in the office of Senator Ron Wyden from the state of Oregon, working on broadly health policy with some focus on end-of-life policy. And I did a second placement with the Centers for Medicare and Medicaid Services because they're the center of nursing home policy. And really what I wanted to do was just learn how the soup got made, what happened behind the scenes of nursing home policy. And then COVID hit and everything shifted to virtual, and a lot of the work that I was doing in the Senate office was less immediately critical. And I certainly was able to see how things got prioritized when COVID hit. And at CMS, our focus shifted almost entirely to COVID. And so, I've been a fly on the wall to a lot of those discussions. And okay. It's just been a really interesting window into the world of policy making.
Right. So I've often told students that nursing homes are like the most heavily regulated industry next to nuclear power plants.
Mm-hmm. We say that a lot. Yeah.
Yeah. So maybe tell someone who's maybe not familiar with the role of the social worker in a nursing home, kind of what is what is that role? We've talked a lot on the podcast about the role of nursing, but you're our first social worker.
Well, when I was working in nursing homes, I always said that the social worker, anything that didn't fit neatly into another department fell under social work's purview. So I did everything from getting people enrolled in hospice, assessing new admissions, monitoring people for psychosocial changes, to finding their lost socks and, helping their family members adjust to, having them be in the nursing home. If it wasn't strictly under somebody else's purview, social work probably touched it at some point. From a regulatory perspective, they're there to meet very broadly assess for and help meet psychosocial needs, which is very broad and could be almost anything.
Okay. And so then, so I think most people have a general idea of how nursing homes operated, during COVID. So maybe talk about some of the changes that have happened and the role of a social worker in the middle of a pandemic in a nursing home. What do you think some of the changes are?
A lot of attention has been focused on keeping nursing home residents safe. It became clear early on that it was very easy for COVID to spread in nursing homes, and some of that is physical plant. You have a lot of frail people living together very closely. Most nursing homes have shared rooms or shared bathrooms, and the same caregivers are going in and out of rooms, providing very close and intimate care. They were hit by the PPE shortage very early on. I know in my own state here in Maryland, nursing homes were third on the priority list for PPE early on when things were very short. It was hospitals, and then EMS, and then nursing homes. And from what nursing homes have told me, it didn't always make it all the way there. And so, from the news perspective, nursing homes and COVID were all about the rising number of cases, the large numbers of deaths. From the social work perspective, I think the bigger piece was, in an attempt to stem that, nursing homes shut down, or CMS shut down for nursing homes, all visitation March 13th. So anybody from the outside coming into nursing homes, we're no longer allowed to do that. All communal dining, all group activities. So very quickly, social workers had to take on this role of helping families stay connected, helping residents stay connected, figuring out how to communicate with families en masse, figuring out how to help residents, many of them with cognitive impairment, figure out devices to see and hear their family members, and provide a lot of support and reassurance to residents, family members, fellow staff. Sometimes in an atmosphere where the social workers were told they were non-essential, or they were the ones who were no longer allowed to go onto the units in an attempt to decrease the number of people coming in and out and kind of preventing that spread. So,
which is interesting if your main job is to help with psychosocial
exactly.
needs. So Lynn, do you have anything to add from what you've been seeing?
Well, I would say that it's been a national disgrace that we don't have a national strategy in our country to deal with the just amazing outbreak. The hotbed of COVID deaths has been in nursing homes, as Nancy was saying. And from the social work perspective, we are now seeing such enormous impact of social isolation on nursing home residents, and also people living in assisted living, other long-term care facilities as well. Because from the social work perspective, we know that people, regardless of whether they're living in nursing homes, assisted living, or living at home, rely on their family and close friends for emotional and practical support. And to be denied access, particularly during a pandemic, to seeing your family and friends, from my perspective, or put on an advocacy hat, is a true outrage in our country. Nancy can talk about this better than I can, but not all nursing homes have trained social workers on staff. But I think the pandemic and the enormous media attention to the plight of people living in nursing homes has really shown that because of the social isolation piece, that in and of itself, and the toll on family members, family caregivers, who are not able to see their parent, their grandparent, their aunt and uncle, really begs for the need for a more expansive workforce that includes trained social workers that really can begin that national conversation to ensure that we have in our country social work and practical and emotional support that is a key component of both healthcare and long-term care.
Mm-hmm. Yeah, so I always thought that all facilities were required to have a social worker as part of their staff. The ones that I've worked in always did. So maybe you can clarify that for us.
Okay, so the as it's laid out in the rule, any facility with more than 120 beds must employ a qualified social worker on a full-time basis. However, a qualified social worker is an individual with a minimum of a bachelor's degree in social work or a bachelor's degree in a human services field, including, but not limited to, sociology, gerontology, special education, rehab counseling, and psychology, and 1 year of supervised social work experience in a healthcare setting working with individuals. This is the only place anywhere in any facility that accepts Medicare or Medicaid that I'm aware of where a social worker or somebody who's defined as a social worker doesn't have to have a social work degree. And I don't know, I really don't know why that is.
So it could be kind of the same struggle we have within nursing. They were only required to have one registered nurse, and even that could be someone with an associate's degree or a baccalaureate degree or higher. But depending on where you live in the country, it's just access to people, in this workforce. So I would think it's probably similar.
I would imagine. But when we look at the important roles that a nursing home social worker needs to play in terms of the psychosocial assessments and care, there are things that I think you need social work training for that I think are important.
Okay. Any thoughts about that, Lynn?
Well, I would add that social workers are uniquely trained to really recognize the importance of family support and also the social aspects of care. So while it's critically important to have adequate nursing and certified nursing assistants in nursing homes, we would all agree with that. If we want to improve quality of care for people residing in nursing homes and other long-term care facilities, COVID-19 has really pointed out that we need to have more social support, more emotional support, and connection to the outside world of family and friends that are critically important, particularly at end of life. It's vitally important. It's really the social determinants of health, and that's what a social worker's role is. That linkage.
And I want to pick up on two things that Lynn has said and clarify them a little bit more for people who might not be as versed in this world. Lynn has mentioned assisted livings a couple of times, and assisted livings are uniquely challenged in the pandemic because they are not federally regulated. The nursing or the assisted living regulations are a patchwork of state regulations. There are no federal statutes that cover assisted livings, and they're not required to have a social worker. So they have faced some of the same challenges as nursing homes with a lot less guidance and and many of them with no social work support.
Yeah, I do think that's one thing the public doesn't tend to understand is the difference between like an assisted living and a skilled nursing home. And the way I typically explain it is if you have a healthcare need that requires a skilled nurse, or the skills that nurses provide, so wound care, catheter care, managing diabetes, I mean, those are all things that would qualify you to be in a skilled nursing home. And if you don't meet those qualifications, then that's not the setting for you. But the assisted living facilities of today are the nursing homes of yesterday. So it's just this hot mess, but families are under the impression that I always told mom or dad I'd never put them in the nursing home, so I'm going to put them in assisted living. It's like, that's actually not necessarily the best thing you can do for them, because like you said, there's this patchwork of state regulations. And so it's not even at the same level. So you'd actually be better off if you qualified. So that's my little soapbox for the day.
No, I absolutely. The other thing I wanted to pick up on was visitation. And it's very much been this conversation around visitors. But they really are, going back to Lynn's background, family caregivers. A lot of family members of people in nursing homes took care of them at home for many, many years before they got to the point where they needed a nursing home. They know their family members' care needs, moods, changes in condition better than anyone else. They are the eyes and the ears. They are the ones who are able to communicate with staff and advocate for their resident, that they are care partners. And yet we've lumped them into this category of visitors, making it sound more like a luxury, whereas they are a member of the care team and they need to be there as a care partner and not as a visitor. And so I have trouble with that definition too.
Yes.
Can I just underscore what Nancy just said? It's so important. I mean, really, family and close friends are not visitors. So I think in some ways, in many ways, actually, the enormous media attention on people residing in nursing homes and assisted living facilities and the lack of access that family and friends have had to the person who they love and they're caring for has really pointed out that family members are not visitors. And hopefully public policy in the future will address this. CMS, the Centers for Medicare and Medicaid Services, recently has taken some steps on allowing family and friends safely to be with their relatives in a nursing home, but much, much more work needs to be done.
So perfect segue into the next question. So future directions or next steps for you, Nancy?
Well, I'm going professionally. I'm going back to my academic life. I teach undergraduate social work students, and my mission there is to get them to think about older adults as a population. A lot of students come into social work school wanting to work with kids, and getting them to see the importance of intergenerational families and all of the ways that they will touch older adults in their careers, whether they think they will or not, and the importance of policy in their day-to-day work with whatever population they're working with. And so that's what I take back to my students. I mean, from my own personal advocacy standpoint, I'm going to continue to talk about nursing home issues and policy to anyone who will listen, whether it's my state legislators on the federal level, and looking for ways to strengthen the social work requirements and the regulations. Mm-hmm. In COVID, dealing with this visitation issue, resident rights were something that were long fought for in nursing homes. Prior to the 1987 nursing home reform law, nursing home residents had no rights. And part of that regulation was this big move to lay out nursing home residents' rights. And one of those rights was access to visitors. And in the interests of safety and protecting residents, that got taken away. And I'm going to fight until that's back to where it should be, and we recognize family caregivers for their important roles.
Yeah, it's been really hard for my mom. In fact, she was supposed to have been able to see my grandmother yesterday for the first time since March, and I just realized she hasn't said anything. So I'm wondering if that happened, because I feel like she would have called me. So, Lynn, any last thoughts?
Well, I just want to speak to Nancy's important role as a social work professor about the importance of advocacy and public policy, because for many of the viewers of your podcast, Melissa, they may not know that advocacy is really the cornerstone of social work, not just at the individual level, working with an older adult, for example, but also at the community level and the society level too. Social work is really about enhancing the well-being of all people, especially the most vulnerable, and shaping good public policies and social policies is really a cornerstone of social work. When I went into aging and social work a long time ago now, it was not to work individually with older adults. It was to work on systems change, to do planning and policy development to improve the lives of older adults and their families, and also to work on social justice issues. And today, a few days after we've lost, and we're all so sad, Supreme Court Justice Ruth Bader Ginsburg, I'm just reminded of something that she said, and I quote, she said, "Real change, enduring change, happens one step at a time." Mm-hmm. That's how we have to view our important work in advocacy and public policy on behalf of older adults and their families.
Okay. Well, that's true. Well, thank you, ladies, for being with me today. And I guess thank you. You really summed it up, Lynn. So I was like, okay, we should just end on that note. All right. Thank you, ladies.
That's great. Thanks.
Thank you.
Thank you for joining us for this special series of This Is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., PhD, in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Thank you for joining me today for This Is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.